Hey, I've got a guest speaker today, Dr. Tontz. He's not only our Chief of Aerospace Medicine, but he's also our Public Health Emergency Officer. And he's going to have a lot to say to us today about where we are, what's next, and what are the next steps. So, some incredible news here over the last 24 hours is that we're going to start getting the vaccine. So we expect the vaccine to arrive at 0800 tomorrow is what I'm tracking. And then I think there's only going to be 20 doses of that. And we've already figured out who's going to take that between our medical group and some of our first responders. But they'll start receiving that on Saturday morning, which is incredible news. So more on that in a second here. But what I'd like to do is just talk to Dr. Tontz here and have you introduce yourself, and hey, why should we trust you?
Sure, Lieutenant Colonel Russell Tontz. My current job is working with the South Dakota Air National Guard. On my other uniform I wear is for Mayo Clinic. Great history, legacy with the Mayo brothers, both one-star generals actually, sir.
Wow, I did not know that.
So very supportive of my mission over here to assist your mission.
Yeah, so let me get this straight. You're a doctor from the Mayo Clinic, and now you're a Red Tail?
I am. Actually, I was a Red Tail in the past, back in 10 years ago out of Al Jaber. So I also am the Masters of Public Health, have a Master's of Public Health as far as, that's the requirement for a FEO type job. So my job is to try to control and mitigate public health risks for yourself and your mission.
Got it. Hey, where did you receive your Master of Public Health from?
I was fortunate. Air Force sponsored me to go to Harvard. Great times, lived in Cambridge, kids, wife, everyone had a great time there.
So let me get this straight. We got a doctor who's got a degree from Harvard and who currently works in the Mayo Clinic and now is a Red Tail.
I've been very lucky, sir, very lucky. So
yeah, I don't know if I'd call it luck. I think you make your own luck, but that's pretty awesome that we have your expertise. What are the things that you've been working on over the last year?
So very interesting in terms of showing up here to deploy location. Back home over the last 8-9 months working with Mayo, my job is to work with the companies and as well as employee health to keep all the employees at different various companies that we work with have relationships with Mayo and their CEOs, their medical directors, to keep them safe and keep the mission going. So actually it's very similar to the mission here. Looking after employee health at Mayo, once again, our employees, our service members. So coming up with mitigating strategies in terms of keeping people safe when they go home and at the same time, safe doing the mission.
Got it. So would you consider yourself an expert on COVID at this point?
It's a great, thank you very much for the compliment. In many ways, I think COVID, no one really knows. No one's really quite the expert, but once again, I've been fortunate enough, I guess, in some ways to go through the stress of the COVID over the last 6 months or whatnot prior to come here. So happy to serve you, sir. Yeah,
how much work have you been doing with the vaccine development? What's your knowledge of the vaccine?
Sure. So the vaccine itself, the DoD has chosen Moderna. The Moderna vaccine is one that's 94% effective. The way I would look at the vaccine, it is something that's a proactive approach. This is our ability to, in military terms, fighter pilot terms, go after it, be the aggressor, create a preventive strategy. Right now we're using mitigating factors, the hand washing, really standard public health type things, social distancing, mask wearing. My mask protects you, your mask protects me. This is, no kidding, a chance to be a bit more aggressive. How do we prevent this the COVID virus from affecting us and taking us out?
Hey, so we just want to be really transparent with the group, and team, I've always said that I'll be transparent with you, and we'll continue to do so. We're not going to keep anything from any of you. So continued discussion. Let's just go through some hard questions on the vaccine and the future of where we think we might be here in the coming months. Do you see us getting beyond the 20 doses that we're getting right now? Are we going to get beyond that to get more?
Yes, sir. So the 20 doses, I would say, is a bit like the train like you fight like you train. So we're trying to get this system as accurate and clean as possible. So from the point of production to the point where it's shot in the arm of the airman. And so a lot of that is designed so that we can get the 20 dose, smaller doses, so we have the system ready for when we have larger doses.
Got it. Can you talk us through, we got 20 doses now, hopefully we get more. Can you talk us through the prioritization of who's going to get it? That's I think a question that people are concerned with, is, hey, we've got it, but when am I going to get it?
Absolutely. And a lot of that is based on what they're doing back home, as far as, if you remember, the healthcare workers, first responders, are working with folks that are potentially immunocompromised. They're also the ones that, this is a health issue, so we're making sure that those folks that are treating us with COVID are healthy themselves, in that they have a lot more exposures. That being said, the ability to triage that as far as which rack and stack, a lot of that will be determined by the leadership here as far as your goals.
Let me just talk about that real quick, because I think you hit the nail on the head there. So here's my thoughts on this. We are in a combat zone. We're conducting a combat mission, a righteous mission that requires all of us to be ready. I think our number one strategy to fight COVID is complying with our disciplined and persistent measure: 6 feet spacing, and washing your hands, wearing a mask. Number 2 is going to be the vaccine. So we'll make sure our first responders, to a certain point, have the vaccination. We'll make sure our med group folks have the vaccination. Then we're going to start getting into the mission really, really hard. That's my intent, and that's what you'll see in the policy letter that I signed last night, which is how we're going to distribute the COVID vaccine. Hey, let's get into some other really hard questions, and I know it's on people's minds. Will the vaccine cause reproductive health issues, sterilization, or affect fertility, particularly for our young people that still have kids that they want to have?
Great question, sir. And a lot of that is what we can go on, what we have of the knowledge as of today. And the American College of Obstetricians Gynecology, the American Society of Reproductive Medicine, they're both saying this is good to take in that population. And so what we can go on is what we have right now, and at the same time, press with that versus, some of the side effects and consequences of actually, no kidding, getting COVID in that population.
Yeah, clearly, if you are pregnant, getting COVID is not a good thing.
Absolutely, sir. There you go, spot on.
Okay, so let's just keep it straight with me, Doc. If I still have to wear a mask, I still have to socially distance right now, why would I even bother getting a vaccine?
So it is a very high recovery rate in the population that we have here locally. That being said, this is many ways you could call it airmanship. It's looking after your fellow airmen, in that if I'm able to prevent getting COVID, I'm preventing the ability to spread COVID, especially with the folks that might be more vulnerable. So yes, 99% recovery for the 20 to 30-year-olds. But what about the other contractors here? Some folks that are maybe 40. Remember, obesity is actually a risk factor. There are folks that have some obesity, even in active duty. So once again, not just the mask, my mask protecting you, your mask protecting me, but if we can eliminate the COVID as far as that possibility for me to spread this, I think it's doing the right thing, sir.
Hey, so in addition to the 99% recovery rate, I've read that if you get the vaccine, that beyond 99% recovery rate, the effects of getting COVID, if you are in that 5% that does actually get it, the effects will be less. Do you think that's true, or can you speak to that?
So once again, it will stimulate an immune response, in hopes that the immune response is good enough 95% of the time to eliminate COVID. That being said, the folks that have that 5%, the hope is that the maximum effect of that will be decreased by having the immunization.
Yeah. Do you think it's our best chance at getting back to normal?
I absolutely 100% think this is our best chance. This is our active tool to try to prevent this from, rather than just mitigating, preventing COVID.
There's some rumors going all around that it might affect your DNA. Can you confirm that or dispel it?
Sure, it's a great comment. As far as this is a little bit different in terms of this is not a live virus. Other vaccines will use the actual virus itself to stimulate an immune response. In this case, we're using messenger RNA, which is part of the cell itself. It forms and stimulates the factories, the ribosomes, to create a protein that will be very similar to the spike protein that actually the immune cells, the defender nation, will go in and create an immune response. So in many ways it's different, but this very well could be the future. Many folks are looking at this technology for ways of treating cancer. So it's in many ways it's safer in that to answer your question, it does not affect the DNA and actually does not actually put the virus itself into the cell.
Okay, so follow up to that then. You know, there's some people that are saying that the vaccine's untrustworthy, that it was rushed into production, that it hasn't been fully tested. What do you say to that?
The technology has been there, so the mRNA vaccine technology. That being said, this is much larger use of that technology. That being said, with technology, it does advance. Most of the vaccines that we have are based on 20, 30 years of how they used to do it. That being said, the emergency use authorization from the FDA, which approves all our other vaccines, has approved this for the emergency use. In many ways, that's balanced with the fact that COVID has turned into a pandemic. That being said, if you read a lot of the guidance for the clinical based criteria or guidelines, they're saying this is safe.
Got it. Okay, so what I think I heard you just say is this FDA approved. Is it in fact FDA approved, and what does that mean?
So FDA, of course, is the governing body that tries to keep us all safe with most anything that we put into our bodies. That being said, this vaccine is approved by the FDA. The caveat there would be the emergency use authorization. However, it still maintained the same authorization for approval as in any other situation.
Okay, so approved for emergency use. If I get it voluntarily and we find out later that there was something wrong with it, can I get compensated?
So the largest electronic medical record in the world is our ALTA, our electronic medical record for the DoD. And so we have the guidance from AFCENT, CENTCOM is to have everyone have this documented in the medical record, as well as an ASIMS, which is the commander's tool for deployment, medical, but it's a commander's tool. And so two different areas where we can get this documented. That being said, any other exposure during the deployment, as we've been through the last 20 years, has been documented. We have ability, probably better than anyone else in the world, to backtrack that, see where you've been in your deployments, especially, or non-deployments, and have that tracked.
Yeah, okay. All right. Hey, the COVID vaccine, is it actually going to give me COVID? Will I have COVID-19 after I get that?
It's not a live vaccine, so we're not getting COVID, we're not giving COVID. We're stimulating the natural, the immunity cells that we have, the T cells, to attack the virus itself. So no, we're not giving people COVID. Now, the response, after the first injection is usually a localized reaction where you have at the injection site. Within 2 days, most folks will have some similar symptoms to the flu-like symptoms, maybe similar to COVID as far as, a bit more fatigued, headache, runny nose, maybe even some GI symptoms. And that's a good sign. That's a sign that the immune system is being stimulated to be prepared to fight the real COVID when it comes.
Okay. All right, here's a question for you. Last question, most important question. Are you going to get the vaccine?
Absolutely. I told my wife before I came here, I wish I was able to get it before. She's planning to get it herself. This vaccine here is not for 18 and under. I have 4 kids under 12. I would recommend 100%. If any of them could get it, I would get it.
Hey, what we need from every single one of you is maintain your discipline, maintain your persistence on maintaining spacing and keeping your mask on, all right? That is ultimately what's going to keep us safe and help us get through with this. Look forward to talking to you again soon. And again, as always, if you have any questions, please don't hesitate to hit the button up here for the Commander's Action Line, and we'll get those questions answered for you.